Typhoid fever is highly contagious. An infected person can pass the bacteria out of their body in their poo or less commonly in their pee. With treatment, most people make a full recovery, but untreated typhoid can lead to life-threatening complications. Hello and welcome to Microbiology Insider. If you're new to this channel, I do videos about diseases caused by microorganisms and microbiology lectures in general. Before I ride on, please do endeavor to hit the subscribe button and turn on your notifications so whenever I upload a video, you'll be the first to know about it. In this video, I will be covering the following objectives. What is typhoid fever? Signs and symptoms of typhoid fever. Causes of typhoid fever. Complications associated with typhoid fever. How can typhoid fever be prevented? And the method of diagnosis of typhoid fever. Typhoid fever is a serious bacterial infection caused by the bacteria Salmonella typhi, and it easily spreads through contaminated water and food. Along with high fever, it can cause abdominal pains, headache, and loss of appetite. It can also be caused by Salmonella paratyphi, a related bacterium that usually causes a less severe illness. The bacterium lives in the intestines and bloodstream of humans. No animals carry this disease, so transmission is always human to human. Signs and symptoms are more likely to develop gradually, often appearing 1 to 3 weeks after exposure to the disease. Early illness signs and symptoms include fever that starts low and increases daily, possibly reaching as high as 40.5 degrees Celsius, headache, weakness and fatigue, muscle aches, sweating, dry cough, loss of appetite and weight loss, stomach pain, diarrhea or constipation, rash, and extremely swollen stomach. Without treatment, you may become delirious, lie motionless, and exhausted with your eyes half closed in what's known as the typhoid state. Life-threatening complications often develop at this stage. In some people, signs and symptoms may return up to 2 weeks after the fever has subsided. Typhoid fever is caused by a dangerous bacteria called Salmonella typhi. Salmonella typhi is related to the bacteria that cause salmonellosis, another serious intestinal infection, but they aren't the same. Transmission through the fecal-oral route. Most people in developed countries pick up typhoid bacteria while they are traveling. Once they have been infected, they can spread it to others through the fecal-oral route. This means that Salmonella typhi is passed in the feces and sometimes in the urine of infected people. If you eat food that has been handled by someone who has typhoid fever and who hasn't washed carefully after using the toilet, you can become infected. In developing countries where typhoid fever is established, most people become infected by drinking contaminated water. The bacteria may also spread through contaminated food and through direct contact with someone who is infected. Typhoid carriers. Even after antibiotic treatment, a small number of people who recover from typhoid fever continue to harbor the bacteria. These people, known as chronic carriers, no longer have signs or symptoms of the disease themselves. However, they still shed the bacteria in their feces and are capable of infecting others. Intestinal bleeding or holes. Intestinal bleeding or holes in the intestine are the most serious complication of typhoid fever. They usually develop in the third week of illness. In this condition, the small intestine or large bowel develops a hole. Other possible complications include inflammation of the heart muscles, inflammation of the lining of the heart and valves, infection of major blood vessels, pneumonia, inflammation of the pancreas, kidney or bladder infections, infection and inflammation of the membranes and fluids surrounding your brain and spinal cord, psychiatric problems such as delirium, hallucinations, and paranoid psychosis. Safe drinking water, improved sanitation, and adequate medical care can help prevent and control typhoid fever. 2 vaccines are available. One is given as a single shot at least 1 week before travel, while the other is given orally in 4 capsules with 1 capsule to be taken every other day. Neither vaccine is 100% effective. Both require repeat immunizations because their effectiveness wears off over time. Body fluid or tissue culture. For the culture, a small sample of your blood, stool, urine, or bone marrow is placed on a special medium that encourages the growth of the bacteria. The culture is checked under a microscope for the presence of a typhoid bacteria. A bone marrow culture is often the most sensitive test for Salmonella typhi. And that's a wrap up for this video. Before you leave, please do endeavor to hit the subscribe button and turn on your notification, not forgetting to follow us on all our social media pages. Let's grow our community together.